Welcome to this video on sudden cardiac death, where we will explore clinical pearls and emergency management strategies. We will begin by reviewing the epidemiology and common causes of sudden cardiac death, including an understanding of the fatal triad and primary etiologies. Sudden cardiac death, or SCD, is defined as an unexpected, non-traumatic death from cardiac causes occurring within 1 hour of symptom onset if witnessed. Statistically, it is the leading global cause of death, with coronary artery disease implicated in up to 80% of cases. The primary etiologies are categorized as ischemic, structural, and electrical. Coronary artery disease is the main substrate for ischemic cases. Structural causes include hypertrophic cardiomyopathy, the leading cause in young athletes. Electrical causes involve channelopathies like Brugada and long QT syndromes. SCD is often explained by the fatal triad: substrate, trigger, and modulator. The substrate is the underlying structural damage. The trigger is the acute event, such as electrolyte shifts or acute ischemia. The modulator involves factors like high sympathetic tone and metabolic acidosis. Certain ECG findings serve as red flags for channelopathies. Brugada syndrome presents with a COVID street elevation greater than 2 mm in V1-V2. Wolff-Parkinson-White syndrome shows a short PR interval and a slurred upstroke of the QRS, known as a delta wave. ACLS management priorities focus on high-quality CPR, maintaining 100 to 120 BPM and minimizing interruptions. Early defibrillation is critical for shockable rhythms. We administer epinephrine every 3 to 5 minutes and actively search for the reversible H's and T's. Post-ROSC optimization involves a bundle of interventions. This includes maintaining oxygen saturation between 92 and 98% and blood pressure above 65 millimeters of mercury. Targeted temperature management between 32 and 36 degrees Celsius is used for neuroprotection. The golden minutes highlight the critical role of time in SCD. In ventricular fibrillation, survival declines by about 10% every minute without defibrillation. Early intervention through bystander CPR and public access AEDs is vital. In young athletes, SCD is often the first symptom of an underlying defect. Prevention and screening require reviewing personal history for syncope during exercise and family history for SCD in relatives under 50 years old. In closing, remember this quote: "The treatment of sudden cardiac death is most effective when it is applied to a community that is prepared to act." Thank you for watching this video. If you have any questions, you can reach out to the EM consultant, Dr. Nasser Hassan. Here are the image sources used throughout this video.